Hello, my name is Marc Merriman. Today I'll be presenting a presentation titled Amnion Membrane Allografts for Knee Osteoarthritis Treatment. This presentation today will go a little bit over a research project that I'm currently involved in within the institute that I work in. Before talking about the research itself, I'll first talk about the institute in which I currently do my research, and that's the Cato Laurencin Institute for Regenerative Engineering. The focus of the research that at the Cato Laurencin Institute for regenerative engineering is the regeneration of complex tissues and organ systems. And many of the projects at the Cato Laurencin Institute for Regenerative Engineering are focused on the regeneration of musculoskeletal tissues, and that include bone, cartilage, ligaments, and also tendons. So going into my specific research project and my specific area of research, knee osteoarthritis is the application for that research. So what is knee osteoarthritis? Knee osteoarthritis is a degenerative joint condition that involves the degeneration of cartilage, but other joint tissues. And as you can see in this picture to the right, there is a clear difference between the osteoarthritic joint and the healthy joint. And how does this affect patients? This causes severe pain, swelling, but it also causes difficulties with mobility for patients. So knee osteoarthritis is a condition that we're currently seeking answers for so that we can improve the quality of life for patients. So let's talk about the treatment, and the treatment specifically that we're investigating in my research is the amnion membrane allograft. So breaking that into two different parts. What is the amnion membrane? The amnion membrane is the innermost layer of the placenta, and an allograft is a piece of tissue that's taken from one person and it's used for medical treatment in another individual. So for our research, why are we really interested in investigating using this specific tissue for osteoarthritis treatment? And that can also be answered in two parts. We're interested in using the amnion membrane for tissue regeneration of cartilage, specifically because it has a number of regenerative molecules that have proven to be able to help heal damaged cartilage. And in addition to that, there's a theory that the amnion membrane may also act as a soft pillow or soft surface to reduce the amount of pressure within the joint. And we're currently, again, investigating that in our research. So let's talk about where we get our amnion membrane from for our research. And we receive the amnion membrane material for our research from mothers who donate their placenta at the time of giving birth. And these mothers, when they donate the placenta, they do know that their amnion membranes will be used for research purposes. So what do we do once we receive those amnion membrane samples? We decellularize those membranes. And how does that process really work? And what does decellularization mean? So decellularization is the removal of cells from a specific material. So in our case, it's removal of cells from the amnion membrane. And how does that process work? And what do we do during that process? So the first thing we do is really clean the membrane, because when we receive it, it's not always clean. And this specific picture is showing antimicrobial solution here. That's what the amnion membrane is sitting in. And once we finish cleaning it, we put the membrane in a -80-degree freezer until it's ready for decellularization. And that is a video showing how we kind of rotate the amnion membrane within this solution so that we really make sure that it's clean. So how does the decellularization step work? And that's going to be explained here. So we put our membrane within a Petri dish, and we pour sodium hydroxide solution into the Petri dish and scrape the membrane. So we use a dual method of decellularization per se. And it actually is really effective at decellularizing the tissue. And once we finish decellularizing that tissue, what we do is lyophilize it. And what lyophilization does is remove all of the water content from the membrane, and what's left after lyophilization is this sheet-looking form of amnion membrane, a dry sheet, I should say. So how do we know if our process of decellularization works? We evaluate the amount of DNA content that's left within the membrane after we decellularize it. And we really want that amount to be less than 40 nanograms after the process, because that tells us that our decellularization process really was effective at removing cells. So what do we do once it's decellularized and lyophilized and ready to go? I should say, ready for investigating if it actually can impact osteoarthritis. So we use rats as our animal model, and we induce osteoarthritis in the knees of the rats previous to implanting our amnion membrane allograft within the knee. And after we implant it, what else is left? That's a good question. We just want to see if this amnion membrane allograft really is effective at regenerating cartilage. And we do that in a number of different ways to really make sure that our findings are thorough. So there's some acknowledgements today. I'd like to acknowledge my PI, Dr. Cato Laurencin, also the Young Innovative Investigator Scholars Program, which I'm a part of here at UConn Health. And lastly, again, the Cato Laurencin Institute for Regenerative Engineering, where we're conducting this really groundbreaking research. Thank you again for watching today, and just a little bit of background about myself. I'm currently a graduate student here at the University of Connecticut in the Department of Biomedical Sciences. And previous to pursuing this degree, I pursued my Bachelor of Science and received my Bachelor of Science from Xavier University of Louisiana. And for me, my current career aspiration is to pursue orthopedic medicine from both the clinical aspect, but also from the research aspect. And I think that any student who wants to become a physician, a doctor, a researcher should get early exposure to those areas in terms of becoming a physician. I think it's really good to get exposure to clinical medicine at an early time point, because you're able to see how physicians are able to improve the quality of life for patients on a first-hand basis. But also, in addition to that, I think that it's important if you're interested in research to get involved in research very early. And there are a number of programs out there for high school students, but also undergraduate students who are interested in research.